Um, so everyone, as you can see here on the bottom left, I was asked by a friend to debunk this article that was sent to his family chat. This is actually pretty common as these types of clickbait headline COVID articles are popping up constantly, and I get asked to weigh in on them frequently as well. So let's dive right in. When you see this, post-COVID lungs worse than the worst smoker's lungs, surgeon says. So this was a Texas trauma surgeon who said that it's rare that the x-rays of her COVID-19 patients come back without dense scarring. So I think the first thing to kind of think about is what kind of patients is a trauma surgeon seeing. So I think that implies a bit of selection bias. So as you can see here on the screen, selection bias is a distortion in the measure of association due to a sample selection that does not accurately reflect the population. What that means in this situation is that she is definitely talking about the much more severe cases that are actually going to go to the hospital and see a trauma surgeon. So this is kind of the people who are in more critical condition from COVID-19. Maybe they're having ARDS, acute respiratory distress syndrome, and these are the patients that are getting these long-term health effects and the scarring of the lungs with irreversible damage that's referenced in this article as well. So most of the asymptomatic to light or even medium symptoms don't have this irreversible lung damage and are healing. That is not to say that they are easily getting back to their pre-COVID condition, but it is something that I do want to point out that think about the patients that she is seeing is the first thing I want to say. And then second, as we go lower, so I believe that she's definitely telling the truth of what she's seen, and in her tweets and even in her interview, perhaps it just seems a bit that the headline was again, if you look at the headline, it's that post-COVID lungs worse than the worst smokers' lungs. They're just trying to imply that what she sees in her patient population is indicative of what will happen to the world at large, which we could say is unlikely, since we've had millions of cases and millions have recovered in the last year. So we could see here also, one thing that I kind of question is that when she says that patients who've had COVID-19 symptoms show a severe chest x-ray each time, and those who are asymptomatic show a severe chest x-ray 70 to 80% of the time. Again, I don't know what she's defining as a severe chest x-ray. Later on, there is this kind of COVID lung, smoker's lung, normal lung. I don't think this is, again, indicative of every single of the people who have tested positive for COVID. Obviously, I do believe that there are people with COVID that look like this, as well as, anywhere along the spectrum with the normal lung and the smoker's lung. Then when we get to the bottom of the article, again, it now switches to an infectious disease expert at Johns Hopkins, and this doctor again does talk about the way that chest x-rays lag. So this is an interesting concept. So it's basically that when you're recovering from something, from like an illness in your lungs, here he's using pneumonia as an example, so just like COVID, it is, it shows like your x-ray is still bad, but your symptoms have improved. So does that mean that your lungs are still damaged? Well, it's just that the x-ray will lag behind your recovery, so you'll feel better while your lungs continue to recover, and then once your lungs are healed, obviously your chest x-ray will look better. There are some, severe pneumonias, including people with COVID getting severe pneumonia as kind of a super infection, but this pneumonia does take a longer time to heal, and if it is severe enough, like you said, some of it may be permanent. So I think I really want to highlight a lot of the kind of qualifying words as well, the sums. There's a lot of other ones here. You may be left with severe complications. And I do want to just kind of end with reviewing this article with saying I agree with everything these doctors said. I kind of have an issue with the severe chest x-ray. Might be the only thing of like, what does she mean by severe chest x-ray? I don't believe that 80% of the world population that has tested positive has a lung like this after recovering from COVID, especially the asymptomatic folks, which I'm sure could be easily proven in a study. This is her anecdotal evidence, and which I believe in her patient population as a trauma surgeon. And finally, just again to say, I agree this is something you can blow off. You don't want to make it seem like, COVID, you'll recover and everyone gets back to their, full functioning lung immediately afterwards. But you also don't want to say, hey, 80% of you people in the world who get COVID are all going to have irreversible lung damage. So I don't think anyone's saying that, other than the article kind of implying that based on a single statement. And even the same surgeon just recommends that if you're experiencing shortness of breath, even after you're no longer testing positive for COVID, stay in touch with your primary care doctor. It ends again on there's no long-term implication of a vaccine that can be as bad as the long-term implications of COVID. So she is advocating for getting the vaccine as well, which I think is another prudent thing that she's saying. So all in all, I would say to my friend to share with his sister-in-law, maybe the headline was just kind of sensational and scaremongering. I don't know how much of your family read the article, which I feel is another issue with these kind of clickbait headlines. But I think most of the information inside, except for the severe chest x-ray, was accurate. So yeah, just want to end on that. Hope that was helpful. Okay, thanks. Bye.